Good evening and welcome to another episode of VIMED. Hope you had a great time today as well when it comes to a Thursday Eve. So today we're going to talk about another very significant topic when it comes to your health. We meet with accidents daily. Sometimes it might be on the roads and sometimes it might be at your own home or at your working place. These traumatic experiences that you or your loved ones might have to face. You should be able to know what you have to do, what your responsibility is, and how to prevent this, as well as what are the techniques that are being used here in Sri Lanka when it comes to the management and treatment these traumatic experiences, these injuries, these accidents as well. So, to do the honors to talk about this, we do have with us today a consultant orthopedic surgeon at the Colombo East Teaching Hospital, Dr. Hiran Amarasekara. Good evening to you, Doctor.
Good evening.
Now, when it comes to these trauma or accidents, or we'll call them injuries, can you please elaborate us what are accidents and how can one meet with an accident nowadays?
Yeah, so this is a very vast topic. Accidents and injuries we come across during our lifetime all over the place, the office, home, on the road. And we can easily sort of categorize them into simple accidents like home accidents, some falls, some you meet with in the office or workplace, or a bit more significant ones like road traffic accidents, sometimes even major ones. We call it major trauma, like you can get caught into a major incident like a bomb blast or a falling building or industrial accidents and things like that. Apart from these, we can also categorize them into according to injury patterns. For example, burns, we call them accidental burns, or drowning. That's again a type of accident where we see. And then also with modern extreme weather-related accidents like landslides and floods and things like that, even tsunamis. So it's a vast topic, and everybody in their life at some point would have come across at least one or two accidents. They would have observed, they would have, their loved ones would have come across, or even sometimes they themselves would have been in an accident. So I think it's a very timely topic, and the topic is very vast. We probably want to elaborate what we could do and also what we have to do in a situation, in accident kind of situation if we are in. So I have sort of thought about and think that we should understand the basic mechanisms, how accidents happen, and concentrate on what is the initial things that we can do, and some of the first aid principles and things we can do as citizens for ourselves or somebody who's nearby. And then what would the professionals do when they come and attend to these patients. If I work on some sort of a scenario, like just imagine that if we are on a major sort of a incident where there is a bomb blast or a road traffic accident with a major sort of a trauma with affecting few people. Initial thing what we do, or the first thing what happens to us is that we will try to find what happened. We hear a blast. You can imagine just few minutes before everything is so calm and quiet, and one blast, and then what we try to do as the human sort of nature is to see what happened. We would say something went off, something was wrong. Then the next thing we will find is to see whether we are injured, whether we are in it, whether we are okay. Then we try to get the situation into our heads and say, okay, we can see people. It will be a very chaotic moment where people are running and people calling for help. What should we do? I know it's difficult. It's easy for us to talk here, but it's difficult for us to sort of have a system where we're trying to work out, okay, something has gone wrong, I'm okay. I think the first thing to do is to stay calm and then evaluate the situation. So it could be just a one-off blast, or it could have secondary effects. Like, and you look around, there's a building that's burning, or there's some other vehicles coming on the road. So it can be an ongoing thing, and if it's an ongoing thing, you should quickly assess that situation, and then you should first make sure that you are okay, you move away from the situation, and then once you're safe, it's nature of the humans to help others, so we don't run away, but we should never run towards it as well. It may be a danger zone. So second thing we should do is to call for help, make sure that we have informed the ambulances, so the fire brigade or the police, and until they are on their way to the scene, then we try to attend these people who are injured. How will you do that? Well, we can do simple things. For example, if somebody is bleeding, we can just apply some pressure and stop the bleeding. And if somebody is lying, and if there's a broken bone or something, and if there's a problem with the limbs, then we can use the other limb. This is basic first aid, where we could use that as a splint, and then use a piece of paper or a sari or something that's tie and stabilize them. What we also can do is to move them away from the danger area to a shorter distance of like a short distance to a safe area. We should emphasize that we should not move them too much, put them in a vehicle or a three-wheeler or something and try to take them to the hospital, because sometimes we can cause more damage. For a classic example is if a patient is injured and fallen, and if we think that he has a spinal injury. Actually, I've got a model of this spine. If we see that this injury, our spinal cord is well enveloped in a bony cage like that, and then the nerves come out, and if this bony cage is broken all around, but the spinal cord which is inside can still be intact. If we lift the patient like that on both ends, this can just separate, and then we cause permanent paralysis and further damage. So we need to make sure that we gently keep the back straight and move them only the shortest possible distance from an unsafe area to a safe area until the ambulance crew comes. If somebody can't breathe, then if something is stuck in the throat, we try to take it out, and then we try to sort of clear the throat. That we say airway. So in trauma we say three important things. One is the airway, breathing and circulation. So we try to make sure that we maintain these things until the ambulance crew comes. So we can do little things that will save lives.
Yes, we do have more to talk about when it comes to how to save a life when you face an accident like this. But coming back to the situation here in the country right now, Doctor, like as for the last 5 years now, it has been one of the major causes for the hospital admissions. The highest number of hospital admissions has been due to accidents, trauma and injuries. So what has been the main reason behind this? Why has a situation like this occurred in a country like Sri Lanka?
Yeah, so that's a very good question, because actually in the whole world, what has happened so far is due to, including Sri Lanka, due to a rapidly developing nature of countries. The trauma patterns have increased, which means the number of accidents has increased, and secondly, the severity of accidents have increased. For example, we have faster vehicles. We have highways, we go faster than before, and we previously 40 years ago we fell from like 10 feet high first floor or a tree or something. Now we fall from 30 floors up apartment high-rise buildings. Weather has been so extreme. We have more landslides, floods, and a lot of natural disasters, including tsunamis. In fact, I have a small slide to show about the hospital admissions in Sri Lanka. If you can just show that slide, we can see that this is from 2019 statistics from Medical Statistics Unit. The highest number of admissions compared to all the other diseases were traumatic injuries, and this causes multifactorial sort of causes behind this. And the second thing that's important is that trauma is something that not only affects sick people, it affects the normal human beings who are young, energetic, who can contribute to the economy, and if either they die unfortunately or they get disabled for life, and that not only impacts the person who gets involved in it, their loved ones, but also the economy. So it is a major cause, and actually WHO at one point said that this is a major epidemic at the moment. Like it was like a pandemic actually. So that's why the importance of these things over the years has come up to this level, that we have highest number of admissions at this moment caused by trauma.
Is it mainly due to road traffic accidents or other injuries?
Mainly it's road traffic accidents. As I said, we go faster. For example, if we take a road traffic accident, if we travel at a slower speed, we rarely be able to sort of break a bone. If it's, for example, if you're traveling at 20 or 30 kilometers an hour, and if you knock someone, a pedestrian, so that's, for example, so that's the big sort of bone, major bone, femur. Now to break this, we can't break at 20 miles or 20 kilometers an hour. You have to go at 70 or 60 or 100. And now with highways being introduced, we are going at those speeds, and they are legal. So with that, these bones break, and we cause the severity of trauma quite higher than before. Not only road traffic, even other ones, like as I said, weather, drowning or floods, all those things. We are doing a lot of sports, which are extreme sports, like diving and things. So with all that, road traffic is the main cause, but all the others shows a rise as well at the moment.
So, well, when we talk about these kind of injuries, now, once a person is brought to the hospital, it is an emergency indeed. So, how is the hospital set up for a patient, especially when it comes to the treatment from the first step itself? What is the setup?
Yeah, so that's again sort of very good question. We need to tell everybody what happens at a hospital. So, initial thing what happens is hospitals are sort of trauma units are geared to handle this, which means that hospital has a system called triage. So what we do is, first, if there's an incident, hospital will be noted by the ambulance crew that we are bringing so many casualties, be prepared. So getting ready is the single most important thing. They are ready for a major trauma situation. And then once the patients come, they do what you call a triage. Triage is actually nothing but sorting patients out, categorizing them, who needs immediate care, who are walking casualties, who are all right, and who are unfortunately cannot be salvaged, or who are dead. So we sort them out, and then we try to treat the ones who need the most treatment with available resources. So hospitals are geared to do that, and in that this is what we call the golden hour of trauma, which means in trauma, the initial impact causes a large number of deaths which are not salvageable. We can't prevent or save them. Then the second large, about 30%. So first one is about 50%. This is about 30% die in the first 1 hour. They are either by bleeding or difficulty in respiratory, whatever. These patients can be saved if you give saline, or if you do intervention at the correct time, the correct intervention. So we can save them. That golden hour and saving them at this initial part is the crucial thing a hospital will do. They will initially do a triage, sort them out, separate the ones that are needed, and then give the care for the needy. And then separate the people who can have a small injury, who are so-called walking casualties, and treat them as well. So that's what in a hospital we do. We also make sure that we separate we keep things calm. We separate the patient from the loved ones. We try to comfort them and things like that, supportive measures.
Yes, doctor. Now, when that happens, like when we talk about the post-traumatic experience, after this, after the immediate care, maybe soon after they are taken to the hospital, what happens after? Some might have to, we might have heard that some might have to undergo surgeries, and then afterwards, some have to still live with certain conditions, post-traumatic conditions. Would like to know about them.
Yeah, so what happens is that initial hour we save lives, and once we save the life, and once we make sure that the patient is stable, after the patient is stabilized, we transfer them, and that we do the emergency procedures over. But for them, to have a pure sort of a cure, they might undergo further surgeries, they might undergo further procedures, and that happens within the next few days in the hospital. And in that during that period, there's another complication that comes within few days or weeks, where we call it infections, and there's a certain number of patients, unfortunately, we lose during that time, even though we try hard to prevent that. During that time, once we stabilize, we need to do the definitive procedure. There's another side to look after. Sometimes they are okay, they are saved, their life is saved, but they end up with some sort of a disability. Either their limb is lost, or some fingers are lost, or something like that. So that's what you call a permanent disability, which they have to live with, and they have to be rehabilitated. So that part comes within the hospital and after the hospital in a rehabilitation process. We have vast experience mainly during war and rehabilitating the wounded and soldiers, and also we have this separate hospitals called rehabilitation hospitals, which take care of these patients. And it's a combination of not only hospitals, the social life, we have to cater to their mental status, then their family life. So it's a combination of whole society getting involved and supporting them to sort of build up a life after the major event.
And doctor, what are the high-risk groups who are more prone to undergo a near-death experience from a trauma?
Well, it depends. For example, we see trauma, major trauma in a younger age group. So we see diseases, other diseases like heart conditions, diabetes in the elderly population. But trauma is actually a disease of the young, energetic people who are very risk-taking, traveling quite fast without taking much precautions. That's their nature. Anywhere in the world, that's the population that are at risk. Also, people who has a risky behavior, like driving without helmet, or driving without a seat belt, driving under the influence of alcohol, or driving and without giving attention to the road. For example, using a mobile phone while driving, texting while driving. This is something that comes sometimes with personality, but not only that. Anybody who breaks these rules and does that, they always take a risk of getting into a trauma situation, which may be dangerous. Also, sometimes we cross and go in a ferry without using a life jacket. Sometimes advice is given, it's very clear, but we don't, and then we might take like 10 times we can do that. The 11th time we don't do that, and we can still get into a bad situation. So that's how trauma works. So.
And doctor, when it comes to certain conditions, we see there are 0 to minus external conditions, external wounds or anything, but the person looks, he or she appears to be normal after a trauma, but sometimes that person might undergo some serious situation after a few days or so. What is the concept behind this? What happens, and is it possible to happen in all traumatic conditions? Would like to know about that.
Yeah, again, it's what we call concealed trauma, or concealed injuries. So sometimes initial injury, when you look from outside, they are quite okay. There's no damage to any other skin or any other structures that we see from outside. But slowly they have some damage in their internal organs, like a spleen, a ruptured spleen, or the chest injury that is not seen outside. And this we see mainly through blunt trauma. So blunt trauma is we just have an impact, there's no external wounds, and there's some injury inside to the brain or some structure. And they keep on bleeding slowly, and with time they deteriorate. And with deterioration, if they are in a hospital, that's fine. But sometimes they even get to a hospital, sometimes we might miss, they go home, and then within the next 1 or 2 days they get worse. So a classic thing that we all should understand is, even if you undergo a major trauma and you think you are safe, and even if you go to the hospital and the hospital says you are safe, it's important to keep an eye on yourself for the next few days. And if you think you get worse, if you think that you don't feel right, you have to come back to the hospital. Another classic thing we see this in head injuries. So after a head injury, initially you're okay, you're conscious, and there's no problem, and then gradually if bleeding develops inside the brain, your sensory or the consciousness can deteriorate over hours. And if that happens, we tell the patients that if something is wrong, if you feel vomitish, or if you feel that you're losing consciousness, something like that, to come back to the hospital anytime after discharge. So that's another thing to keep an eye on.
Well, prevention is the most important thing out of all. Would like to know about it, especially our viewers. We need to inform them how they can prevent such instances in their life.
Yeah, as I touched on it before, the key thing, as we said, in any disease, prevention is better than cure. And trauma prevention is basically taking simple, common sense steps, but we have to take those steps all the time. An example, say, to prevent road traffic accidents, what should we do? There are many things you can do. First is keep to the speed limit. The speed limit is given anywhere in the world in that region. For example, in front of a populated area, in front of a school, is for a reason. As I said, 20 to 30 miles an hour you travel, or 20 kilometers or 20 kilometers an hour, knock someone, you can't break a bone, you can't kill that person. But you go at 70 miles an hour in a 20-mile zone, that can be disastrous. So that's very important. The second thing is you have to take care of, as a driver yourself, wear the seat belt, make sure that you concentrate 100% on the road, avoid the mobile phones or any distractions, texting. Needless to say that alcohol is it's totally illegal, and under the influence you lose all forms of sensors, and that's one of the disastrous highest cause of deaths from trauma is under the influence, driving under this alcohol.
And sleepiness as well.
And then yes, sleepiness. If you're tired, you take a break. If you're going on a long journey, stop, take a break, things like that. Other ones, again, helmets for riders. If you're going on a ferry or anything to do with water, wear a life jacket. Simple things. But there will be guidance in industrial areas. There's area which is not safe, you wear helmets, the white helmet, and then you go to that area. You make sure that everything has good lighting. And something about home. Home accidents are increasing as well. So we need good lighting. We need to make sure the surfaces are dry. We see a lot of falling, sort of slipping and falling at home when the floors are wet. Initial structure, you should not have shiny, sort of slippery. You should have very sort of rough floors, things like that, to prevent, and especially mainly the elderly. So simple things like that will prevent an accident and may even save the life.
One final word from you, Doctor, before we wrap things up, regarding traumas, injuries and accidents, how to behave, what to do, and what we should know about.
Yeah, so the first thing is, as I said before, prevention is better than cure. Prevention is simple things which we can do, as I said, like seat belts, and even taking care of the vehicle, making sure the brake pads are good, things like that what I mentioned. So that's the most important thing, and those are the things we can do. But unfortunately, some things we can't. It's beyond our control. If you happen to be in a trauma situation like a terror attack or a bomb blast, then, as I mentioned, keep calm, evaluate the situation, first be safe as a person, and then you can help others. When helping others, keep in mind simple things, learn some first aid if you can, what to do, and then move people from a shorter distance from unsafe place to a safe place, and then call for professional help as soon as possible. These simple measures will make a big difference.
Indeed. I think that message is very important to almost all of you in order to save your life as well as the loved one's life as well. So we would like to thank consultant orthopedic surgeon Dr. Hiran Amarasekar for being with us today and give you this information, these most important messages for you all indeed to save your lives, especially when it comes to traumas, accidents and injuries as well. Thank you very much, Doctor.
Thank you for having me.
Yes, and we invite you to join another episode of iMed next week as well. For the moment, take care and stay safe.